When we last reported on work requirements in state Medicaid programs, it was after a U.S. appeals court invalidated work requirements in the state of Arkansas. At that time, the appeals court said that the Centers for Medicare and Medicaid Services failed to show how work requirements would promote the primary objectives of Medicaid, which is to furnish medical assistance to provide access to medical care and overall improve the health of the people of that state. At the time of that ruling in early March, 10 states had already had approval from CMS for their waivers that allowed work. 2 states had suspended implementation, and more had federal approval or were awaiting implementation. Some were waiting on the outcome of some litigation. Utah was the only state with an active work requirement on the books. But as of April 2nd, Utah has suspended its Medicaid work requirement due to the coronavirus emergency. The state acknowledged that job loss and the economic crisis accompanying the health crisis meant that they needed to get rid of that barrier to Medicaid to allow more people to get access to the healthcare services, the testing, and the treatment they might need. Now, the Utah Health Policy Project agreed with this decision, calling the requirement of having a work requirement in the first place misguided and unlawful in the best of times. They also added that was certainly inappropriate given the COVID-19 pandemic. They finished by saying that the barriers to healthcare need to be eliminated, especially in the time of an emergency. So right now, no states have active work requirements in their Medicaid program. There are some changes that some states are asking for, some enhanced federal money to come in to help support their Medicaid program. Should states accept that money, they would have to prove that they don't have anything restrictive on their books that would keep people from getting their Medicaid in their state. And a lot of states could say that work requirements on their books would be too restrictive to have. So this conversation isn't over yet. We will keep you posted as more states ask for that federal assistance, and certainly if anything changes in Utah or any of the other states as this pandemic continues.